thinking about is when should we stop habitually using ice? I think a lot of times therapists and patients get in the habit of just icing everything for some reason. And ice has its place, but if we just looked at that slide and we know that inflammation really only lasts from, minute 30 all the way to hour, 72 or the first, 1 to 5 days. And here we are at 6 weeks with a rotator cuff tendinosis or a post-op patient, and we're still icing and stimming. Maybe we should be using heat with modalities or heat to stimulate that vascularity. Something to think about. It reminds me when we watch, baseball, and you see that pitcher, you see Clayton Kershaw in the dugout at, for him earlier, but 6, 7, 8 innings, and they're sitting there wrapped in ice to control any inflammatory process rising. What the TV doesn't show and what people don't realize is Clayton Kershaw and these baseball players, they're probably doing 3 to 4 times the amount of cardio later that night at 11 at night to revascularize that tissue. So keep thinking blood flow, because that's how tissues repair.